In an effort to enhance the management of health information, two highly motivated entrepreneurial women have introduced an innovative and user-friendly solution called Ajuda, a secure digital health vault. Now, this service allows individuals to conveniently store their health data and also access it promptly at any time and from any location using a secure login on their digital device. For more insight, we are joined by co-founders of Ajuda Health. That's Dr. Liza Street as well as Taryn Uhlman. A pleasure to have you both to speak to us this evening. Dr. Street, I'll start with you. From your experience as a pediatrician, how did the challenges of managing children's health records specifically influence the design, but also the functionality of Ajuda?
Good evening. Thank you for having me on your show this evening. As a pediatrician, we find that there are multiple times when our pediatric patients go attend various healthcare providers. They attend physiotherapists, they attend nurses for vaccinations, they're attending school, and they attend different GPs or casualties for any reason. And when they come to see us, the moms are expected to rely on their memory at what happens to all these visits. And it can be very difficult for me to make an accurate diagnosis and try and pull the pieces of the puzzle together if I don't have all the health information together in one place. So it's a time-consuming exercise, and therefore that's what caused us to want to create a health vault where everything can be housed together.
Taryn, with your background in technology and marketing, from what I understand, what were the key considerations in designing Ajuda to also be user-friendly and accessible? How did you address potential tech barriers for users?
Firstly, in healthcare, we've seen very much, and if you look around at the various solutions that do exist, healthcare is very corporate-driven and always has been very corporate-driven in South Africa. We really turned this around and tried to make something that was very consumer-driven. We don't look at it as a medical app per se. We rather look at it as a consumer-facing app for an individual or a person to use and to engage with on a daily basis. We also have made a decision not to look at patients as ill all the time, but rather look at people who are both well and ill at various points, but might need a variety of information at any given point. So in terms of my background, I came from more of a media streaming space, video streaming. It was an entertainment service, ideally. And so you have a lot of insights around consumer behavior and, how best to market to particular, through the digital medium, but also how to really make sure that your user interface and the user experience is very intuitive and very comfortable. Technology often still feels scary to many people. And we've agreed between, Liza and I, we're very clear that even within the healthcare space, doctors themselves are very reluctant to change. And so a large part of what we are doing is really to walk you through the process, hold your hand, make it very easy, very visual, and really try and say, health is not scary. We'll work with you as you get more comfortable with tech and to take you on the journey.
Liza, how does Ajuda then enhance the accuracy but also the comprehensiveness of medical records for clinical standpoint? Can you share an example of how having complete health information can change patient care as well?
Absolutely. So, for example, if you the biggest problems is the overuse and underuse of medication. So the overuse in that if a patient comes in and they've just had bloods done a week or two before, you may repeat those bloods because you didn't have access to those blood results. And that's very traumatic from a pediatric, or any adult would also not want to have bloods taken from them unnecessarily. So you're wasting resources and you're making whoever's funding those blood tests repeat the bloods. Similarly with x-rays or any intervention that we do, you are going to repeat investigation that may not have been necessary to repeat. Further to that, when we look at antibiotic usage, antibiotic resistance is a huge problem and it's becoming an epidemic in the future. Everyone warns of antibiotic resistance emerging in the 2030 and beyond. So for us, we need to be very cautious how we use antibiotics. And if patients are attending various GPs or various practitioners and no one is communicating and coordinating their care on behalf of the patient, then we are going to increase the risk of antibiotic resistance. Those are just two examples. But in like we said, in the olden days, we would all go to one GP, and that GP would be the coordinator of your care. Now, with everyone moving around and you get access to the providers who are available, so you're not necessarily, people don't really stick with one GP anymore. They stick with a practice, or they stick to wherever they can find an appointment. So you need to now coordinate your care as the individual, and that's what we're promoting, that you need to actually take ownership of your health and make sure that you're not being prescribed things more than once, etc. So from a clinical practice, we look at it from both medication and from investigations.
Right. Taryn, can you elaborate on the development of the one-time form feature? How did you ensure it simplifies the process for users? And what was the design process behind it?
Yep, certainly. The one-time form for us felt like the most obvious thing in healthcare that has been missing for forever. You know, we all go to doctors, we all go to clinics, you'll go and have x-rays, you'll go and have bloods, and every single time you're filling out your information again and again and again. And personal information, and if you have a medical aid or, you know, person responsible for the account, that's standard information that really does not need to be filled out every single time. It should just remain in one central place. So really it was designed to remove the burden of stress off the patient when they are in the rooms and maybe have a child who's crying, someone who's very sick, or you're in casualty. It's a very stressful time, and really not a time when you want to be looking for your medical aid card or to be filling out information. Separately to that, we've got what we call the health components of that. Yeah. And as you will know, whenever you go and sit across from any healthcare provider, they will ask you about family history, allergies, etc., and medications that you are on. We really believe that when you fill out that information, you should not be in that environment. You should be in your home, comfortable, do it once, get the right names of the medications, remember the correct dosages. You know, most people don't know their blood types. Many people don't really know that they're even allergic to certain things. Once you pull these things together, it means that, you know, when you're seeing the doctor has a holistic view of you. We often say, you know, imagine a world where you sit down at your doctor, and already before you've even opened your mouth, they have got a full view of who you are, your age, your, you know, any of the chronic issues that you may have and any of the challenges that you may have. And they can already start their diagnosis of you from a point of knowledge. And I think that is largely, it's administrative and time, money, and obviously from a holistic care perspective that we thought the one-time form was so valuable.
Dr. Street, what feedback have you received from other healthcare professionals about Ajuda's impact on patient management, but also the treatment plans? And to extend it a bit, how does it improve their ability to provide care from what we've been able to address so far?
So with the one-time form in particular, you know, we are all taught at medical school in 4th year to ask all those questions that we have put into that one-time form on the medical profile. And now what happens is when the patient walks in with all that information accurately completed, all the dosages are there, etc., the practitioner now can really focus on what is the problem today. So for example, if you're on antihypertensive medication and you walk in with a headache, the practitioner then can check your blood pressure and make sure that they can adjust the medication from the correct dose that you were on. Whereas if you walked in and you didn't know the doses of the medication or what the medication name was, then your practitioner doesn't really know what to give you and how to improve if your blood pressure was out of control. The feedback has been really wonderful because it's helping them, it's causing a more convenient care. You know, a lot of technology that is created for doctors is really it's very much a practice administration software that they are using to improve their administration processes. Whereas with the one-time form, it's the first thing that actually improves the diagnostic and holistic view of the patient and doesn't increase their time spent with the patient in doing so, but rather reduces it.
Taryn, how do you plan to promote Ajuda to a broad audience, if you will, but also ensure it reaches those who would benefit from it most? And what strategies are you using to create awareness and drive this adoption?
So we've got quite a multi-pronged approach. Firstly, you know, being in the pediatric space, from Liza's perspective, both of us are moms of young children. And a lot of where Ajuda stemmed from was a frustration that we didn't have all of our children's records in one central place. There's multiple, they're very busy medically when they're little. They're getting vaccines and milestone checks and signing up for schools and requiring lots of information. And this information tends to be very scattered and fragmented. So one of the very first paths that we are going into is into the school environment. We really want to ensure that every South African child, it is our vision to make sure that every single South African child receives all 6, what we believe are the 6 key screenings that they need to have, which includes your eye screenings, your ear screenings, nutrition, vaccines, mental health, and then if from a sports perspective, things like concussion. So we, in a lot of our research and in our on-the-ground work that we've done, we've seen that most, obviously there's a very big split between the public and private schooling space, as well as in the healthcare space. We are agnostic to all of that, whether you are in the public space, private space, whether you have got a medical aid or you don't. We are there for every person to create their own ecosystem as it exists for them. And so largely, excuse me, why we are going into the schools is because we want to really help capture a lot of that information and work with parents and the schools to make sure there's a central repository of that information. That's the one approach. And then secondly, from a B2C and a more general marketing perspective, being a digital and technology platform, we want to meet our users where they are. And we want to make sure that we have got a very robust digital strategy, which we do have. PR is obviously very important. And on-the-ground events. We recently just did a screening in Krugersdorp for Nelson Mandela Day at a tutor center. And it's invaluable, the information and the insights that you receive back from those kind of interactions that really help to, A, communicate what we are doing, but also to really understand the challenges so we can iterate the product to suit various markets.
Dr. Street, as we begin winding down our conversation, in what ways do you think Ajuda could specifically benefit families with children who have complex or chronic health conditions?
Absolutely. Those children often do attend multiple practitioners. So they will be attending an OT, a physio, a psychologist, etc. And so for those families, those moms may attend a clinic that has all of those practitioners in one place, but they may not have time to communicate with each other to tell the mom what's going on. Like this with Ajuda, all the information is placed onto their profile by the individual practitioners, and then the mom can holistically view all what was said and recommended when she gets home, and she then can coordinate it herself in the comfort of her home, and then make sure she does the necessary follow-ups to all those various practitioners. Children with chronic illnesses, it's very traumatic for those moms. They really have to, their hands are full, and we need to make it as streamlined, as easy for them, and Ajuda can at least cover this and help them with that.
Let me thank you both for your time. That's Dr. Liza Street as well as Taryn Uhlman sharing their insights and experiences with us. They are the 2 women behind this phenomenal innovation that is Ajuda.